Now to the latest on COVID, where Colorado is starting to see an increase in young people testing positive. We continue to see sharp ups and downs in the number of cases. The spikes range from 1,300 to 1,700 daily positive tests over this past month. Hospitalizations are holding steady as the most vulnerable people continue to get vaccinated. 351 people are currently in our hospitals all across the state. That number has been below 400 since late February. Alan Janae tracking these numbers for us tonight. And Alan, health experts say it's the younger people that are driving the spread right now.
Well, the transmission of this disease, Karen, is changing. A larger proportion of young people are testing positive for the virus. Now, remember, many young people remain asymptomatic, so it is hard to know how many may be transmitting the disease because they may not be getting tested. But talk about hospitalizations in young people, and it's a different conversation.
I think it's definitely a mix of some people becoming apathetic to it, desensitized to it just because we've been in this pandemic for so long.
Young people out in Wash Park tonight were thinking about it. And so are the people who treat those with COVID, like Dr. Richard Zane. Who is it who's ending up in the hospital right now?
We're seeing a higher proportion that skews towards a little bit younger. The disproportionate numbers of people in the 20 to 30-year-old age group is increasing pretty dramatically.
While COVID mortality is down with vaccinations up and younger people less likely to end up in ICUs, some still get the worst of it.
When there's so many, you are bound to have some numbers of people who become symptomatic or even severely ill.
Dr. Zane understands the weariness of the pandemic. People see how less risk may result in taking chances.
They don't really think about the broader perspective of passing it on to other people.
But now variants are adding trouble. Increased transmission or severity, it's not clear.
We have to assume that variants have something to do with it. We can't prove that yet.
But as Colorado reopens, there are decisions to make about risk and sharing COVID.
Just staying vigilant with the precautions until we have herd immunity is really important to me.
Dr. Zane thinks the way the virus is getting passed around hasn't really changed a lot over the past years. He doesn't think that he's seen much transmission in great big super spreader events of hundreds of people, but more likely, he says, in events in which there are maybe a dozen people or so indoors and not wearing masks. In Denver, I'm Alan Janae, covering Colorado First.